Welcome to your deep dive. This one's all about addiction treatment. And wow, you really went all out with the material this time.
Yeah. Excerpts from a textbook for professionals. And a whole bunch of references, too.
You weren't kidding around when you requested this deep dive, huh? Looks like you're really ready to dive deep into this topic, which is awesome.
It's clear you don't just want to know what addiction is. You want to know what professionals actually do about it. Like, how does treatment actually work? And I got to say, this textbook is perfect for that. It gets into all the nitty-gritty.
Yeah, one thing that really struck me was how the book kind of takes apart that idea that addiction is like a one-size-fits-all problem.
Right.
It says someone can be using a lot of a substance but not really have like severe problems because of it, or even be physically dependent on it.
Yeah.
So like, why is that such a big deal when it comes to treatment?
Well, because it means you can't just use the same treatment plan for every single person.
Yeah.
And expect it to, work. Someone could be using a ton of something but not have any withdrawal symptoms, while someone else might be like totally desperate to change but just not have the skills to cope without, their drug or whatever.
Yeah.
So treatment has to be tailored to that individual person. You know what
Yeah.
I mean? You can't just give them a label and call it a day.
Yeah, no, that makes total sense. And that idea really comes through in how the book talks about the harms of addiction, too.
Oh,
It's
yeah.
not just about like overdoses. It also
Exactly.
talks about stuff like fetal alcohol syndrome, how families are impacted,
Right.
communities,
Yeah.
the effects kind of ripple outwards.
Yeah, absolutely. And that's exactly why the book takes what they call a public health view of addiction.
Right.
It's not just something contained within the person who's struggling,
Uh,
It affects everyone around them, too.
yeah.
So, like, seeing those different dimensions of addiction,
Yeah.
that's key to figuring out how to intervene and prevent it.
I thought it was interesting how the book talks about how we've understood addiction over time, like how that's changed.
Oh, for sure.
It mentions how the DSM, that big diagnostic book,
Yeah,
used to just lump addiction in with personality disorders,
right.
almost like it was some kind of character flaw.
It's amazing how far we've come, honestly. That whole black and white view, like addiction was some moral failing.
Yeah.
It really held us back from treating it effectively.
Yeah.
Now we know it's way more complex than that,
Mhm.
It's this whole continuum, a mix of biology, psychology, social stuff.
Right.
It's not about good versus bad people. It's about understanding each person and what they need to get better.
Yeah, and I can see how that old way of looking at it made it hard for people to like ask for help early on.
Oh, totally.
The book even talks about people wondering if they're alcoholic enough,
Oh, yeah.
or if their problems were like real problems.
Yeah. It created all these barriers that didn't need to be there.
Mhm.
People felt like they had to hit rock bottom before anyone would take them seriously,
Right.
And sadly, that whole mindset messed up prevention efforts, too.
You're right.
The focus was only on those already deep into addiction instead of seeing it as a spectrum of risk, where you could intervene earlier and maybe prevent things from getting so bad.
Okay, this is where things get really interesting to me, I gotta say.
Oh, yeah.
The book, dives right into the neuroscience of addiction, how drugs actually hijack the brain's reward system.
You're right.
I know you're super into this stuff, so can you break it down for us a little?
So basically, think of it this way. Your brain has these pathways, right?
Okay.
And they're the reward pathways.
Okay.
And they get activated when you do things that are super important for survival,
Like what?
like eating
Yeah.
or having sex. And when that happens, your brain releases dopamine, right, which makes you feel good and makes you want to do those things again.
Right.
But drugs, they sort of tap into those same pathways, but they do it way more intensely, like artificially.
Oh, okay. So it's like they're hitting the brain's pleasure button, but like on overdrive.
Exactly.
Yeah.
And the problem is, over time, the brain gets used to this constant flood of dopamine.
Uh-huh.
It stops reacting as much
Yeah.
to those natural rewards, so you need more and more of the drug to get the same feeling.
So that explains why some drugs are more addictive than others.
Yeah, exactly. Like heroin, for example, directly stimulates those opiate receptors, right?
Okay.
Which leads to a much faster and more powerful addiction than something like, marijuana.
Oh, that makes a lot of sense. So it's not just about willpower or someone's character. There's a real physical reason behind it.
Exactly. There's this biological component at play that we have to understand if we're going to develop treatment strategies that actually work.
All right, so we've talked a lot about the problem,
Yeah.
but what about the solutions?
Mm.
The book goes deep into how treatment actually works, and there's this one quote that really stuck with
Oh,
me.
yeah. What is it?
By the time people accept specialist addiction treatment, their problems have often reached a severe level.
Hmm.
That's kind of powerful, don't you think?
It really is, and I think it really underscores how important early intervention is.
Mm.
You know,
Yeah.
waiting until someone hits, like, rock bottom can have devastating consequences.
Yeah.
And that's why all healthcare professionals have a role to play here,
Oh, interesting.
not just addiction specialists. We all need to be able to recognize the signs of addiction early and, like, intervene before things get totally out of control.
So it's not just about specialized addiction centers,
Yeah.
it's about incorporating this knowledge into everyday healthcare.
Exactly. This book has some great tips on how to screen for addiction, but it also stresses how important it is to build trust with patients. Like, you can't just bombard them with questions and expect them to open up.
Makes sense. If someone feels judged or shamed, they're probably going to clam up.
Right. And that can delay treatment and make recovery even harder. It's about creating a safe space where people feel okay asking for help.
For sure. The book also talks a lot about motivation,
Oh, yeah.
which seems like it's been a controversial topic. In the past, it used to be that if someone wasn't ready for treatment, it was seen as pointless.
Yeah. Thankfully, our understanding of motivation has come a long way. We know now that it's not some fixed state. It changes over time. And there are ways we can help people become more ready to change.
Like what?
There are methods like motivational interviewing. That's one.
Can you give us an example of what that looks like?
Imagine you've got a therapist working with someone who has a problem with alcohol, right?
Yeah.
Instead of lecturing them about the dangers of drinking, the therapist might ask open-ended questions like,
Yeah.
what are some things you like about drinking? And then what are some things you don't like about it? This helps the person explore how they feel about it, the good and the bad, and hopefully helps them identify their own reasons for wanting to change.
So it's more about helping them find their own motivation to change rather than forcing it on them.
Exactly. And you know what? It's surprisingly effective, even with people who don't want to be there at first.
It sounds way better than the old tough love approach, that's for sure.
Yeah, it's way more empowering. And it fits in with the book's whole message that people are more likely to change when they feel supported and understood, not judged or shamed.
This is all so different from how addiction and recovery are shown in movies and stuff.
Oh, it's night and day.
Hmm.
This book gives us such a more nuanced and compassionate view of addiction and recovery. That's what makes it so valuable. It challenges those old stereotypes and gives us a roadmap for a more humane and effective approach to treatment.
So what's next in the book?
Well, let's move on to something that can often be overlooked,
Okay.
but it's something that plays a huge role in recovery.
I'm intrigued.
Let's talk about the people in the addict's life,
Okay.
particularly family members and loved ones.
Okay, I'm all ears. What does the book have to say about that?
It's so easy to just focus on the person with the addiction, but their relationships are a huge part of it all.
Right.
It's like a double-edged sword, really.
I can see that. I mean, relationships can make addiction worse, but they can also be super important for getting better. So what does the book say about all that?
Well, there's a whole section on family involvement. And not just like support groups for the family. It's about how families can be part of the actual treatment process.
Huh.
Yeah, and they even highlight this specific approach called craft.
Craft.
Yeah, it's all about teaching families how to support change without enabling the addictive behavior.
So it's not like those intervention things you see in movies where everyone's yelling at the person.
Exactly. It's way more effective than that, too. The book mentions studies showing that families who use crafty were way more successful at getting their loved one into treatment.
Oh, wow, compared to the traditional advice giving and confrontation stuff.
Yeah, like a lot more successful.
Those numbers are pretty impressive. It seems like CRP really gives families a way to help, even when they feel like they have zero control.
Oh, absolutely. And that idea of empowerment, that's a big theme throughout this whole book. It's not just about stopping the drug use. It's about giving people the tools to build a whole new life.
Yeah, the book really gets into that whole skills thing, huh? It talks about how to handle cravings, how to be in social situations where there might be drugs, even stuff like job training and managing money.
It's all about getting to the root of what's contributing to the addiction and giving people the resources they need to actually thrive without needing the drugs or alcohol or whatever it is.
Right. It's not as simple as just telling someone, just say no.
Nope. They need a whole set of tools to deal with the challenges of recovery. There's this one line in the book that I love. It says, discharging a client to unemployment is an invitation to failure.
Whoa. That's a powerful statement. It makes you realize that recovery isn't just about the addiction itself. It's about rebuilding a whole life.
Exactly. And speaking of rebuilding a life, the book really emphasizes how important it is to look at relationships not just as potential triggers, but also as sources of support and strength. Remember that case study where the wife, with all her criticism, actually drove her husband back to drinking after he got out of rehab?
Yeah, that was a tough one. It really shows how, even when people have good intentions, their relationships can totally sabotage recovery if they aren't healthy.
It's not about placing blame, though. It's about understanding how those dynamics work and figuring out how to communicate and interact in ways that promote healing, you know?
Mm.
The book actually has some really practical advice for this, like teaching couples to set boundaries, to talk to each other better, and support each other's goals in recovery.
It really is a team effort, isn't it? Recovery, I mean. It's not just the individual person going through it.
Absolutely. And
Mm.
part of that is acknowledging that, like, setbacks happen.
Mm.
The book actually talks about relapse in a really refreshing way.
You mean how it doesn't treat relapse like a total failure?
Yeah. It says that slip-ups happen and
Ah,
that it's super important to respond with compassion and understanding instead of judgment and punishment.
I remember that part. It suggests asking these three questions after a relapse. What's up? What's new? And what's needed?
Yep.
I love that approach. It's so much better than making someone feel bad for messing up. It's about figuring out what happened and learning from it.
Right, exactly. Relapse doesn't have to be the end of the road. It's a chance to learn, make adjustments, and get back on track.
It's definitely a much more realistic and humane way to look at recovery.
For sure. So now let's switch gears a bit.
Okay.
There's another thing that often comes up in addiction treatment. Group therapy.
Okay.
I know there can be a lot of misconceptions about what that is, so I'm interested to see what the book says.
Yeah, I have to admit, when I picture group therapy, I just see a bunch of people sitting in a circle, like crying and telling their sob stories.
Haha. Well, it's not quite like that. Sharing experiences can definitely be helpful, but the book talks about a specific type of group therapy called skill-building groups.
Skill building.
Yeah. These groups are all about teaching and practicing those coping skills we were just talking about,
Mm-hmm.
like dealing with stress, managing cravings, navigating social situations, that kind of thing.
It's more focused on learning tools and how to use them rather than just like venting about your problems.
Exactly. And there's actually a lot of research showing that this type of group therapy is really effective, especially when the group is well run and the people in it are supportive of each other.
Makes sense. Does the book give any specific examples of different types of groups?
It does. Like, for example, women often do better in all-female groups,
Oh, interesting.
probably because they feel more comfortable talking about things that are specific to women, like trauma or societal pressures.
Yeah, that makes sense. It shows how important it is to tailor treatment to each individual's needs. What else does it say about group therapy?
Well, there's also a warning that poorly run groups can actually be harmful. If the group becomes a place where people just reinforce negativity or enable each other's bad habits, it can do more harm than good.
So it's not enough to just throw a bunch of people in a room and call it group therapy. You really need a skilled facilitator who can make sure it's a positive and helpful experience.
Exactly. Okay, ready to move on to something a little bit controversial.
Ooh, I'm intrigued. Lay it on me.
Well, the book actually dedicates a whole section to spirituality.
Ah, yeah, I can see how that could be a touchy subject for some people.
It is.
Like, some people might be uncomfortable with the idea of religion or spirituality being part of addiction treatment.
Right. But it's not about pushing any specific beliefs on anyone.
Okay.
It's more about exploring those big questions of meaning and purpose and connection.
Yeah,
The stuff that can be really important when you're in recovery.
I get it. Like tapping into something bigger than yourself, something that can give you strength and hope when you're struggling.
Exactly. And there's tons of research showing that being involved in religion is actually a huge protective factor against addiction.
No kidding?
Yeah, on par with genetics.
Wow.
But even for people who aren't religious, there are other ways to find meaning and purpose in their lives.
Right.
Whether it's through nature, art, music, helping others.
It's about finding what resonates with you, what gives you a sense of connection and purpose.
Exactly. And that can be incredibly powerful on the road to recovery.
Okay, so all this talk about spirituality and meaning,
Yep.
it makes me think about all the ethical stuff that must come up in addiction treatment. It seems like a field where there's a lot of gray areas,
Yeah,
a lot of tough decisions to make.
you're absolutely right. Addiction treatment comes with its own unique set of ethical challenges. And thankfully, this book doesn't shy away from them. It tackles them head on.
Phew, I'm glad to hear that. So what are some of the ethical dilemmas that the book talks about?
Well, I mean, the first thing that pops into my head is confidentiality.
Oh, yeah.
Like you're dealing with such personal, private stuff.
Right.
There are limits to what you can share, even if you're worried about someone.
Absolutely. You hit the nail on the head there. The book talks about those situations where a client might tell you something that puts them or someone else in danger,
Right.
like threats of violence or child abuse, that kind of thing.
Yeah.
Those are some really tough calls to make, and the book gives you this whole framework for figuring out what to do in those situations.
So it's like a balancing act. You're trying to protect your client's privacy, but also make sure everyone's safe.
Exactly. And it's not always easy to know what the right thing to do is.
Right.
It takes a lot of careful thought,
Yeah.
talking to other professionals and really understanding the ethics of addiction treatment.
Wow. It makes you realize that being a therapist in this field is a huge responsibility. You said it. But it's also so rewarding to help people through such a tough time. And, the book really drives home that addiction is treatable.
That's good to hear.
It might be chronic, like, say, diabetes or heart disease,
Okay.
but people can recover. With the right support and resources, people do recover.
I think that's a really important message, especially for people who are struggling and feeling hopeless.
Absolutely. And speaking of hope, the last part of the book is all about prevention. It reminds us that addiction isn't just a personal problem. It's a whole societal thing.
That makes sense. So what does it say about prevention? Like, where do you even begin with something that big?
Well, the book breaks it down into different levels.
Okay.
First, you've got your universal strategies.
Okay.
Those are aimed at everyone, like public awareness campaigns, education in schools, policies that make it harder to get drugs and alcohol,
Yeah.
that kind of thing.
So like a broad approach.
Right. And then there are more targeted interventions focused on groups that are at higher risk, people with a family history of addiction, people with mental health issues, that sort of thing.
So it's about coming at the problem from all sides.
Exactly. And it's important to remember that what works in one situation might not work in another. You have to tailor your approach to the specific context.
Yeah, that reminds me of how the book talked about prohibition.
Oh, yeah.
It was this huge attempt to control drinking, but it totally backfired.
Exactly. It just shows that simplistic solutions rarely work.
Right.
You need a nuanced approach that considers all the factors that play into substance use and misuse.
The book also mentions how important it is to identify risk factors early on, right?
Yes. Stuff like family history, mental health issues, even certain personality traits that might make someone more likely to develop an addiction.
Gotcha.
The earlier you can catch those, the better. That way, you can get support in place and maybe prevent things from escalating.
It's like getting ahead of the problem.
Exactly.
Wow, this has been an incredible deep dive.
It has.
We've covered so much, from the brain science all the way to prevention.
I know, right?
It's obvious that you really care about understanding this, and this book gave us a ton to think about.
Definitely. It's so great to see someone so passionate about learning about addiction treatment. This is such an important field, and we need more people like you who are informed and ready to make a difference.
Well, this is the end of our deep dive for today, but we want to leave you with one last thought to ponder. If, as we've learned, treating addiction is really about teaching skills and providing support, what does that say about our society's role in all of this? Does society help create these problems, or could it help prevent them? Something to think about as you continue exploring this topic.